Hey everyone! Today we're talking about how to treat an acute exacerbation of COPD. This is super important because COPD flares can get serious fast. I'll break down the steps you should take, including medication doses and what to do in both outpatient and hospital settings. Let's dive in. Let's start with a typical COPD patient having an exacerbation. They're experiencing worsening shortness of breath, increased sputum, and maybe a change in sputum color. First, we need to assess how severe it is. If the symptoms are mild to moderate, you can usually manage this outpatient. 1. Bronchodilators. Start with a short-acting beta agonist or SABA like albuterol. A common dose is 2 to 4 puffs using a metered dose inhaler or a nebulizer treatment every 4 to 6 hours. Combine this with ipratropium, another bronchodilator. Nebulizer treatments often use a Doneb solution. This contains both albuterol and ipratropium. 2. Steroids. We use oral prednisone, and the standard dose is 40 milligrams daily for 5 days. This helps to reduce inflammation in the airways. Keep the course short to limit side effects. 3. Antibiotics. These are needed if there's increased sputum purulence, volume, or if the patient requires mechanical ventilation. First-line choices include azithromycin or amoxicillin clavulanate for 5 to 7 days. 4. Oxygen therapy. If the patient's oxygen saturation is below 88%, start oxygen to keep their saturation in the 88 to 92% range. Use a nasal cannula and adjust as needed. Now, if symptoms are severe or the patient doesn't improve with initial treatment, they need to go to the hospital. In the hospital, we use nebulized albuterol and ipratropium every 1 to 2 hours and then taper based on the response. Switch to intravenous methylprednisolone, usually 40 to 60 milligrams initially, then move to oral prednisone 40 milligrams daily once they stabilize. The total duration is usually around 5 to 7 days. If there's evidence of infection, start broad-spectrum antibiotics like levofloxacin or ceftriaxone. Use oxygen to maintain 88 to 92% saturation. If they're struggling to breathe or have high CO2 levels, use BiPAP or another form of non-invasive ventilation. Once they're stable, educate them on a COPD action plan, optimize their long-term medications, and arrange a follow-up within 4 to 6 weeks. And that's the treatment for an acute COPD exacerbation. Remember, timely intervention can make a big difference. If you found this helpful, please like and subscribe for more medical insights. See you next time.